Congenital fibrosis of the extraocular muscles, also called Abiotrophic Ophthalmoplegia externa and congenital fibrosis syndrome. Disclaimer: this video is for informational purposes only. The information and content in this video is not a substitute for professional medical advice, diagnosis, or treatment. For any questions, concerns, or inquiries, see your primary healthcare physician or a licensed healthcare provider. Never delay or hesitate to speak with a physician because of data provided in informational documents and videos. What are the other names for congenital fibrosis of the extraocular muscles? The other names for congenital fibrosis of the extraocular muscles are Abiotrophic Ophthalmoplegia external and congenital fibrosis syndrome. What is congenital fibrosis of the extraocular muscles? It is a disorder that affects the muscles around the eye that are responsible for eye movement and positioning. Congenital fibrosis prevents normal development and function of eye muscles surrounding the eye. Those affected with congenital fibrosis cannot move their eyes normally. The challenges include looking upward, side-to-side eye movement can be limited, and misalignment of eyes such as strabismus. There are multiple forms of congenital fibrosis such as CFEOM1, CFEOM2, CFEOM3, and Tuchel syndrome. What are the symptoms of congenital fibrosis of the extraocular muscles? Symptoms of congenital fibrosis of extraocular muscles: limited ability to move eyes upward and downward, limited eye movement, movement of head instead of eyes, and droopy eyelids such as ptosis. What are the causes of the extraocular muscles? CFEOM1 and CFEOM3 is an inherited autosomal dominant genetic conditions. It occurs when a single copy of any abnormal gene is inherited. The abnormal gene can be inherited or caused by gene change. Gene change causes a mutation. CFEOM2 is an inherited autosomal recessive genetic condition. It occurs when two copies of an abnormal gene for the same trait is obtained from each parent. What are the means of diagnosis? Congenital fibrosis of the extraocular muscles is diagnosed using special attention to eye and malformations via an eye examination, measurements of the ocular eye misalignment, ocular range of motion, glove eyeball retraction, and palpebral fissure size. Vision tests. What are the means of treatment? The means of treatment include standard therapies. Refractive errors such as focusing problems can be treated with eyeglasses, contact lenses. Amblyopia, reduced vision, can be treated by reduced vision usage. Eyes are temporarily blurred once a day using atropine drops. Surgery can be done to improve vision, reduce ptosis, prevent vision loss, and correct misalignment of the eyes.